Hello, everyone. Welcome to the HES Sim Week, Society for Simulation Healthcare. Welcome to the Friday. So I'd like to introduce, and not waste any time, get straight into it. I'd love to introduce Helena Wagner Porto Rocha, MBA, PhDC, Senior Project Manager in Higher Education Academic Operations at Universidad Europea, Leader of Design and Efficiency Initiatives for Laboratories, Simulation Centers, Teaching Clinics, and responsible for continuous improvement, innovation, and expansions. She is also a researcher for the SimLab, Observatory for Effects in Realism in Simulation, in Healthcare Simulation notably, and at the School of Health and Biomedical Sciences at Universidad Europea de Madrid.
Thank you.
No problem.
Happy to be here.
Thank you so much. So I think at this point we would love to see your presentation, and please, if anyone has any questions throughout, please don't hesitate to put that on the chat on the right hand side, and we can certainly answer them.
Towards a new concept of realism in clinical simulation, developed by the SimLab team, Observatory for Effects of Realism in Healthcare Simulation at the School of Health and Biomedical Sciences at Universidad Europea de Madrid. The level of accuracy with which reality is represented in clinical simulation. Its purpose is to categorize simulated practices into low, medium, and high fidelity experiences. Fidelity, unclear terminology that needs to evolve. Authors such as Hamstra and Thun raised at different times the need to refine, clarify, and subcategorize the term fidelity. The Simulation Dictionary identifies the term fidelity as potentially controversial and unspecific in its various definitions. There is a wide variety of definitions for fidelity that can generate confusion on the same subject. Conceptual fidelity, structural fidelity, functional fidelity, psychological or emotional fidelity. In addition to the vague and inconsistent use of the terminology, defining who assesses fidelity is also essential. Should it be the simulated participant, the student, the instructor, the simulation technician, biomedical engineers, marketing associates? These are the most common profiles that have contributed to articles, catalogs, training courses, and scientific events on the topic so far. On the other hand, what assessment tools have been used? What do they measure? The simulator, the scenario, the simulated participant? How many dimensions do they comprise? And also worth questioning, are they objective? Have they been validated theoretically and statistically? Have they been tested through large sample studies? Through extensive review of articles, we have found that overall realism of the scenario was often rated considering only the realism of the simulator. And in some cases, the realism of the simulator was rated without factoring in scenography or the acting component that influence on the overall context. There are multiple factors that influence the perception of realism, and it can be compromised when not assessed in its entireness, possibly incurring in an investigation and research bias. The term fidelity is associated with the accuracy with which simulated reality is represented and is classified as physical, conceptual, emotional, and experiential fidelity. For a student or participant in the scenario, the three types of fidelity combine, resulting in the perception of realism. Mimicking reality is a complex and elusive task. So to cover potential gaps in realism, Dickman suggested instructors establishing an explicit agreement with the students or participants, a fiction contract. Through such contract, the instructor recognizes the limitations of realism and seeks the commitment of the students and participants to act as if they were in a real situation, which depends to a large extent on the student's willingness to want to believe. This fiction contract allows the simulation to take place adequately, despite the gaps in realism that may exist. For Rodolph et al., realism is based on learners' perception rather than on the simulation characteristics per se. One may perceive a certain degree of realism, while other may experience it at a very different degree, even though the scenario is the same and has the same level of fidelity. The concept of realism is important because it involves the perspective with the greatest impact on learning, that of the direct participant. Its limitation is that the learner's viewpoint is insufficient for an objective evaluation. The learner's perception may be influenced by many factors, such as the fictional contract established, the safety of the environment, the briefing received, the learner's experience level and knowledge, emotional factors, capabilities, skills, or the difficulty of the task, among others. The theoretical argument proposes the use of the term realism instead of fidelity, conveyed through categories and subcategories, commending expert instructors as the most reliable appraisers, giving the objective perspective on the matter, and therefore more reliable as a gold standard. This, however, does not exempt us from duly considering the student's perception of realism, which is so important in the educational, emotional, and ethical processes derived from the realistic pretensions of scenarios. Students' perception is collected through simple questionnaires linking qualitative descriptors to a Likert scale of 1 to 10. ProRealSim 1.0 is an online model to measure realism of 3 pivot dimensions: simulated participant, scenography, and the simulator. It should primarily be used by experts or designer instructors, exploring great variety of indicators to a granular level. Types of realism. Intended realism. For a holistic and didactic approach to intended realism, some aspects should be taken into consideration, such as the learning objectives, context, students' characteristics, and the design team capability to find alternative solutions that raise realism. Attain realism. ProRealSim 1.0 allows measuring attained realism. Perceived realism. Perceived realism is a unique perspective and variable intrinsic to the student. Systemic variables. For best interpretation of realism, 2 systemic variables should be taken into consideration. Precision. Precision qualifies what can be classified as reliable at the conceptual or physical level. It measures the realism of the structure and concept expressed through design or theory. For example, if a smartphone looks like a smartphone from a structural and conceptual point of view. Naturality. Naturality qualifies what can be classified as reliable at the functional or relational level. It measures the realism of the operation of a device and how it relates to the other elements of the scene. For example, if the smartphone works like a smartphone and responds realistically when being used as such. Dimensions of realism. These are the 3 most frequent dimensions of stage realism in simulation. Realism of the simulator. The realism of the simulator measures the similarity between the simulator or component that allows technical interventions or maneuvers and the patient or structure being represented. ProRealSim 1.0 measures it through 18 indicators of precision and naturality. Realism of the simulated participant. The realism of the simulated participant measures the similarity between the actor's interpretation, professional or amateur, and the real situation being interpreted. ProRealSim 1.0 measures it through 17 indicators of precision and naturality. Scenographic realism. The scenographic realism values the similarity between the environment that hosts the simulated action and the real physical place it represents. ProRealSim 1.0 measures it through 11 indicators of precision and naturality. Quantitative tool to assess attained realism. The conceptual considerations were integrated into a global quantitative tool that calculates the index of attained realism, and the appraiser being the instructor or expert in the knowledge field. Over a 3-year study combining Delphi method and statistical validation through correlations, Cronbach Alpha, and Gutmann's Lambda 6, researchers of the SimLab group developed ProRealSim 1.0 to evaluate the attained realism in simulated scenarios. ProRealSim 1.0. ProRealSim 1.0 is an online theoretical and mathematical tool that has been validated and is now available in both English and Spanish to be applied worldwide free of charge. It can be run from a variety of devices and, given the versatility of its indicators, can be very useful for many health sciences programs applying the clinical simulation methodology. The following might be listed as the strengths and advantages of applying the concept of realism and deploying ProRealSim 1.0. The following may be listed as the potential limitations. What should be taken into consideration by appraisers? Attention point to appraisers. Key success factors. What should be taken into consideration when assessing realism through ProRealSim 1.0? Appraiser profile. What is the most suitable profile for a realism appraiser? Specific conditions for index calculation. Complete all fields with values ranging from 1 to 10. In case a specific indicator is not applicable, the field should be left blank. A maximum of 3 fields for each dimension may be left blank, otherwise the index cannot be calculated. Qualitative data and fields cannot be left blank. Title of activity, specialty, profile of the appraiser, etc. Otherwise, the index cannot be calculated. Dimensions can be measured in isolation. To be taken into consideration by the appraiser, if you have any questions, please contact us through the feedback tab, located in the upper right corner of ProRealSim page. Thank you.
Thank you so much, Helena. That was a fantastic video, very insightful, very categorize or don't categorize is really the question with these things. And you did exactly that, which is what you know, simulation needs at this point, especially when it comes to definitions such as fidelity. I know from my personal experience, a lot of the institutions in the West aren't ready for the phrase fidelity, and I'm so glad that you've approached that topic in such a systematic way. So thank you so much for that video.
Thank you.
Is there, Helena, is there, before we press on to questions, is there anything you'd like to add following that presentation?
Would like to emphasize the tool is available, you know, like for free in English and both Spanish, and we're going to soon be translating into Portuguese as well. And would like to encourage its deployment in different simulation centers around the world. And mention that we're, as a sim lab and part of a big research team, we're looking forward to have more data points and have, you know, like codes assigned to different projects or types of scenarios, so we can further refine the tool. You know, like there are, of course, opportunities for improvement. This is our version 1.0. We already noticed some opportunities for improvement that we're already working on for a new version that should be launched, you know, like sometime early next year. And really encourage its use. It's really simple. It's really user-friendly. It could be used from different platforms, you know, like from a mobile phone, from an iPad, or from a computer. So I would like to leave it at that point, but I think scrolling through the tool and understanding, you know, like all the categories and really getting familiar with it, it's easy, and I think it could really, you know, like improve the way the scenarios are set up.
Fantastic, thank you. Yes, certainly I'll be looking at that tool and seeing how we can implement that at Innovus, definitely. So I do have a number of questions that were submitted prior to the session, which is fantastic. Now, I think it'd be interesting to find out in what kind of scenarios, do you have any examples of scenarios or situations where the tool can be used? I think this would be useful to hear for any sim labs or even sim creators out there.
Of course, of course. Well, I can share my screen and show the categories, but I'll probably just do it verbally. By accessing the tool, you're gonna see it's like a drop-down menu where you can see different types of scenarios. You can do it like in a HESO chamber, you know, like with mirrored glasses and observation room really adjacent to it. You can do in real clinical settings when you're doing, you know, like continuous education for medical staff. Or you can even do it open air, you know, like what we often do here in the university. These are big simulation exercises, you know, like of big events, like from fire to all the first attention care needed. So there's no limitation, you know, like you can use that to different scenarios to the way the scenarios can be composed, you know, like here we take the perspective of the simulator participant, if there is an actor or not. But also the scenography. So we have like these three perspectives combining. So you can apply to any context at all. Yeah.
Fantastic. Sounds like a really a wonderful tool. Very, very wide ranging in terms of its application. So next question for you is what would the appraiser have to do in order to use this or utilize the tool?
So the tool is online, right? So if you input all the data points and there are Likert scales for different dimensions, and once you start filling it out, in the end, you press like the calculate button, and you're gonna have a matrix that shows you the results for all the different dimensions, right? So again, if you are a faculty member, you want to appraise a scenario, you can just definitely go into the tool online, complete it, and you're going to have a result immediately, right? So in the sense that ideally we always recommend that the appraiser doesn't do the evaluation by himself. It's always good to have more than one appraiser. So in the end, you have like an average perspective. And the experience that we have is the most experience and teamwork the team has, you know, like in terms of defining the learning goals and setting up the scenario, the gradings end up being really similar. And we also like to emphasize that even though you repeat the same scenario over and over again with different groups, things can happen from one scenario to the other that may affect naturality of the flow, you know, of the session. So we would recommend collecting those data points every time the scenario is run, even though there's no structural change, but there might things that might flow differently that might affect the naturality index.
Fantastic, thank you so much. I think someone has asked for a link to the website, which I'll just provide in the chat for you there. Please correct me if I'm wrong, Helena. I think
yes,
that's the right one.
Perfect.
Very good, very good. Now, I think a follow-on question to that, which may be useful for people utilizing the tool, would be: at what point in the simulation, or what point in the scenario would you use this? Would you use it before, in order to tailor the scenario? Would you use it during, perhaps, although I don't really see the benefit of that, potentially at the end, as a post-operative analysis? What's your thoughts on that?
All of the above. So the idea, because since you're gonna have things that are related to the physical space, those are things that you can anticipate, because it's really how realistic it looks like, it feels like, it smells, and all that. But the naturality component, as I mentioned before, it might change depending on how the scenario evolves. So I would say it's just like keep an eye during the exercise and after the exercise, you know, like complete different aspects. So what we're definitely working on still, and this is one of the opportunities for improvement, is really identify the items that we could, you know, like complete before the scenario, then during the scenario, and after the scenario, because some apply to different moments of the simulation. And we also have to be really attentive not to let a lot of time go by after the simulation takes place to complete that, you know, like, so the idea is to have it done immediately, right, on spot, and preferably on site, you know, like you can do it remotely after, like, you know, observing a video, but being on site has its value as well. So those will be our recommendations.
That's really interesting. I think certainly being on site and having a contemporaneous view of things, so having it live and having some situational awareness will be invaluable. Applying that and then running that assessment multiple times throughout the simulation sounds very interesting. Have you, and this is a question for myself, have you done any analysis, say on a test case, say for example a simulation run through? Have you analyzed the assessment data output, say pre, during, and post, and do you notice any trends as a result?
Yeah. So we're currently collecting data on that. So we have doctoral theses going on and case studies that we're running. So we're about to publish articles that are already under review by publishers. That we're gonna have those statistic and hard data available that actually provided us inputs for us to keep improving the tool.
Fantastic. That's really good to hear. That's really good to hear. I guess a follow-on question for that from myself again, because we haven't received any questions in the chat just yet, is would you be able to fail the assessment? I mean, say for example, is there a pass fail? Is there I guess an accreditation that you can get as a result of the assessment, or is this purely just for the simulation providers to really assess themselves and see how they're doing?
Yeah, it's an assessment not on a person or on the appraiser, right? So it's ideally it's a tool that's going to help you measure if what you had designed for your learning objective is attained, you know, in the sense of sometimes we apply really, or we're preoccupied, you know, like with having really realistic simulator, but in the end the competency that you're working on is more towards communication or something else that's not necessarily tied, you know, like to how advanced the simulator is. So that's why we use this tool, you know, to definitely make sure that all the appraisers and the faculty involved in designing the scenario, they're aligned in terms of what needs to be achieved, and that's a way to measure it. You know, like it's a leveling tool to make sure that we can guarantee consistency and quality in the practices. So it's not necessarily a fail or pass, but it's just really a checkpoint to make sure that what we wanted to do, it's able to be deployed. You know?
Fantastic. Thank you very much for answering those questions so diligently. I think we've had a really good point from the audience, from Cairo, from Sahir, who actually said this is really fascinating, really interesting, but he thinks after some hands-on, sorry, she thinks after hands-on with practice, you know, we may then get some questions. So what would be the best way of contacting you, Helena?
You know, like through our feedback tab in the tool per se, it's our contact. So it's gonna come to us, the whole group of the Sim Lab, and we can definitely, you know, like have sessions. We can even do like a training, you know, like to make sure the tool is used to its best potential. And we're available for questions. So the feedback tab has a direct email that's gonna come to us. Okay, it's gonna come to me, to Glavis, which is our IP. And we'll definitely address it fast because we're certainly interested in having more users applying it in their simulation center so we can get more and more data and keep improving it.
Fantastic. Thank you so much. Well, I think at that point, we haven't had any further questions, but thank you so much for joining us, Helena. Thank you to everyone all around the world for joining us and tuning in from all the different time zones that we've had this week. And thank you so much, Curtis and Amy, for arranging such a great week and the session today.
Thank you so much for having us. Happy to participate.